We are in our City Hall. Although it is closed to the public, we are activated as a virtual City Hall. Welcome to our first of a weekly virtual town hall meeting. And just to let you know, we have over 300 residents that have registered to participate today, and we're very encouraged actually by that reaction to our residents, from our residents. We are currently obviously in an unprecedented time in the city of Palm Coast. It is alarming what we're actually watching develop throughout our country, throughout our world. COVID-19 is nothing short of not only a pandemic, a crisis. Many communities are facing challenges on how we best communicate with our residents. We felt strongly that communication and education has got to be a priority and a key component to combat the spreading of this virus throughout our community. We are a community of over 90,000 residents. We know that our residents are dealing with a lot of anxiety throughout this process, so hopefully that helps get them responses, up-to-date responses. This is going through Palm Coast Connect, our communication tool, our resource, that one source of information and truth that we have partnered with all of our stakeholders that are involved in this crisis, and we have met the challenge head on. We are taking this very, very seriously. We have ordered a proclamation, stay safe, stay home. We are not only encouraging that our residents stay home, we are requesting that they stay home unless absolutely medically necessary. We know firsthand that the only way to combat this virus is to socially distance as much as possible, and that means to stay home. We're also in the middle of a wildfire, not an active wildfire. However, we have activated our EOC. We are watching our drought index. Our numbers have been creeping up. We know from history that is a very dangerous precedent in our community. And so we are actually now also making sure our first responders are kept safe. We need them to be healthy. We need them to be well in order for them to respond not only to the daily calls they continue to receive, but if indeed a wildfire were to occur in our community, we have to have all men and women on deck and healthy and safe to combat wildfires. So please do your part. We know that every single one of our residents has the ability to literally mitigate the spreading of this disease if they heed our advice, heed our warnings, heed their strict regulations and restrictions that not only the state, the county, and your local community has requested and required of them, that we know we can mitigate as much of the spreading that can occur in our community. You have the ability to save lives by doing this. You have the ability to be part of the solution. And we are definitely encouraged by our residents' response. We're encouraged by you listening in today. This is also broadcasted on WNZF. This will be podcasted later. And also on our Facebook page and on our Palm Coast Connect page, so you can view it following it. There's going to be a lot of information discussed each week, so we want you to be informed, we want you to be engaged, we want you to stay safe. I'm actually now going to introduce our two co-hosts for our weekly updates on our virtual town hall. We will have special guests here from week to week that will also be answering your questions. Some of it has to do with public safety, some of it has to do with our hospital system. And so we are going to be presenting this in a way that is hopefully helpful to you, and hopefully helpful for you to share with others on why it's so important that we're doing this and why the orders that we are going to be continuing to submit to our residents are adhered to, that enforcement will be taking place. And we will not take our eye off of this for 1 second. All the questions that have been submitted, they will be on our Palm Coast Connect page, probably later today or tomorrow morning. We will continue to update those, and so our residents will have the ability to always have them at their disposal. So without further ado, I'm actually going to be turning this over for an introduction with our city manager, Matt Morton, who has been on the front line.
Good afternoon, and thank you for everyone taking the time to join us today. It's really a privilege to have this great opportunity to communicate directly with you and engage with you, our residents. We have been taking this as a city extraordinarily seriously. We began addressing this event, this global crisis, in early February. We have been working tirelessly with our regional, state, and federal stakeholders, trying to understand day by day, minute by minute, the best information. We have seen extraordinary leadership from our mayor and our city council. We have a daily EOC briefing, again, with all of our stakeholders to understand, again, as you know, sitting at home, hour by hour, minute by minute, as information has changed, how we respond, how we plan, how we prepare to address the situation. We took the lead early as a community with suspending our utility shutoffs and late fees. We've addressed, to the extent we can, ameliorating conditions for our elderly residents who don't have toilet paper. From the big picture to the little picture, we as a city, as your city leadership, have tried to stay on top of this. We will continue to work very hard through this event. Every day our EOC now meets. It has for over a month, internal EOC, where all of our staff members, all of our team members bring their professional perspectives and assistance to managing and mitigating this crisis. We come at it from many qualified perspectives. I think that's lending a great deal of success and support to this effort. And again, I'll just reiterate what the mayor has said. The only thing we know that works right now, which is why we're coming to you virtually, is social distancing. We're practicing that here. As you're aware, City Hall has been closed for 2 weeks. We have the majority of our workforce able and working remotely, heeding our own stay-at-home, stay-safe order and the governor's order. We're limiting to essential tasks. Those folks who had non-essential tasks since early on and will continue have been reassigned to helping our residents, to assisting departments with essential safety functions, to assist with cleaning and sanitation functions, to assist with communications and messaging. And so we have deployed and mobilized our entire staff team to help us work through and find a path forward. Additionally, I do want to note that the city is open for business. We continue to do the functions that we're required and that will help our community once we exit from this crisis. Our business licensing divisions, our building permit divisions, our compliance divisions, and stormwater, utilities, all those continue to operate modified to follow the executive orders in our stay-at-home, stay-safe order. But we still have business to do on a day-to-day that we owe to this community. And that business is important. I want to reassure everyone that we continue to conduct business on the behalf of our residents.
Thank you so much for that update, Matt. And now I would like to also introduce our second co-host. Bob Snyder has been doing an extraordinary job, frankly, being the lead in this endeavor, this effort to keep our community safe. He is the health officer of our Flagler County Health Department. Bob, do you want to give an update?
Thank you, Mayor Holland, and Matt, thank you. Good afternoon. I'd first like to share current data on cases from the state of Florida and here in Flagler County. This information is accurate and is produced by the State Department of Health. The number of positive cases comes directly from the state public health, hospital, and commercial labs and automatically populates the statewide surveillance database system. As of this morning, total positive cases in Florida is 6,741. Total hospitalized statewide is 857, and total deaths number 85. The mortality rate is 1.5%. In Florida, 70,567 individual test results have been received by the Department of Health. 200 labs across the state are now processing tests, which is a huge increase from 2 weeks ago. At this time, the state has an adequate number of ICU beds, and this is the case locally at our hospital. In Flagler County, we have 18 total positive cases, including 1 non-county resident and 1 person hospitalized. Total persons under investigation in the county is 203. Of that number, 18 tested positive and 185 tested negative, for a positive percentage of 9%, which is below the state average of 10%. What I just shared is available to the public, and the information is updated twice a day, at noon and at 6 p.m. So please go to www.floridahealth.gov. This is the only valid source of data in the state, along with the CDC website. You can get total cases, the number of positive and negative test results by city and county, and so much more. So our public health goal still remains the same: to stifle the virus spread from person to person. There are two realistic paths to achieve this population-level immunity. One path is the vaccine, which experts say is a year or more away. The other path is for the disease to work its way through the population, and for those who are positive for COVID-19 to recover and become immune. A Teflon status, so to speak. I'm sure that most of you viewed the White House press conference yesterday, in which the President and his public health advisors shared some sobering news regarding the new modeling forecasts about deaths that nationally could range from 100,000 to 240,000 Americans. Different parts of the country and states have managed the response differently. Florida has focused on containment and mitigation efforts. So our outcomes could be different if we stick with the plan and adhere to the many executive orders initiated by the governor, Flagler County, and the city of Palm Coast, as the mayor just mentioned. Locally, what comes to mind is your city's Stay Home, Stay Safe emergency proclamation, and the county and city of Flagler Beach's order to close the beaches. With no vaccine, no antiviral medication, these containment and mitigation strategies need to be embraced like never before. If you have the clinical symptoms of fever, cough, and shortness of breath, self-isolate and call your healthcare provider or health department. Stay home, stay put, and avoid others. Practice rigorous hand washing, smother your cough and sneeze, use generous amounts of hand sanitizers, work remotely from home if you can. Support local businesses through takeout and home delivery services while practicing social distancing. And disinfect surfaces, especially those that are frequently touched, and please try not to touch your face. We know that's hard. At the health department, as the mayor said here, it's all hands on deck. My dedicated and focused team are donning the proper PPE attire and testing throughout the day. We collect and package specimens for transport to the state lab in Jacksonville. We monitor those positive cases and people who are self-isolating for 14 days, monitor the persons under investigation, and we are very busy now doing contact tracing, a very critical epidemiological task. We connect with the close contacts of an infected person, screen them, and identify individuals that have prolonged contact with positive cases during the last 14 days. Now, the key word here is prolonged, which is exposure within a 6-foot distance of an infected person for greater than 30 minutes. Examples of a close contact might be a spouse, someone you're having intimate relations with, an immediate family member, or an in-home caregiver, for example. Also, the close contact reference includes people who cough or sneeze and don't cover their nose or mouth, and the droplets spray in your direction. Not cool. Please do your best impression of Dracula when you must. A few recent developments that occurred over the weekend is worth noting. Abbott Labs has produced a rapid testing kit and has begun manufacturing 50,000 per day that can provide test results in minutes. This will be a game changer, nationally and locally. Also, antiviral medications are in clinical trial in New York, specifically hydroxychloroquine in combination with the Z-Pak. Governor DeSantis asked that this combination of medications become available to the hard-hit counties and health systems in South Florida. Also, several executive orders by Governor DeSantis will limit our exposure to travelers from Louisiana and the New York State tri-state area. So we're getting many questions about wearing masks. Yesterday, Dr. Fauci shared with the nation that the White House Coronavirus Task Force is very actively discussing with the CDC the idea of recommending broad use of masks. Part of the issue is that supply of masks today will not meet demand currently. But two things we know for sure. Positive and presumptive persons with the clinical symptoms should be wearing masks. Also, healthcare workers who are in constant contact with patients should be protected. If you are fortunate enough to have a mask, wear it. If you don't have a mask, use a scarf, use a bandana. But what about masks for food preparers and servers? Per the Food and Drug Administration, there is no current evidence that supports the transmission of COVID-19 associated with food or food processing or food packaging. Anyone preparing food or distributing food should practice social distancing, wear gloves, practice frequent hand washing before and after donning, place extra emphasis on cleaning and disinfecting services, and not allowing sick employees to handle or distribute food to the public. Again, if you have a mask or face covering, do wear it. Lastly, this crisis has been compared to fighting a war against an invisible enemy. Those foot soldiers on the front lines are working tirelessly to save lives, and they are your public servants. At the health department, hospital, nursing homes, long-term care facilities, EMS and fire rescue, law enforcement, and city and county employees. Jonathan Lord and his crew at the Emergency Operations Center, and those who are providing an essential service, grocery stores, pharmacies, and takeout delivery establishments. Flagler County, we have your back. This is our calling, and we are endeavoring to do what is right and caring for you in a caring and compassionate way. Flagler County, guess what? We will get through this together with a healthy dose of determination, cooperation, and support for each other. Thank you.
Thank you for that very important update, Bob. We will now start the question and answer period, and followed by that, I know you'll have the opportunity to ask questions live that Cynthia will be asking us towards the end of this, and then we'll also be providing some closing statements followed up with that. The first question is, everyone is stuck at home, following the rules, needing entertainment. We have some great Flagler County and Palm Coast websites full of film information. Can we promote the Flagler County Historical Society? You know, that's, I think, the great part of our community. Our stakeholders are invaluable during this process. Not only do we continue to promote all things Parks and Recreation, Historical Society from the county, from the city, our Palm Coast Parks and Rec team have put together a lot of virtual programs and opportunities for our residents to stay safe in their home, to social distance, not be out, and about, and to take advantage of that virtual component. So you're going to hear a lot more about some of these developments. We continue to add more and more as each day goes by. So thank you, Mr. Ryan, for your question. I know it's invaluable that we continue to engage our community. It's imperative that we stay connected to our residents, and we're trying to do every single thing we can possible with the understanding to stay at home. And so think about that. If that period of time where you're wondering, you know, I just need to get out, I just need that moment of you know, being free, I would just encourage you, the more we are socially distancing, the more we are staying at home, hopefully the sooner we will get through this. We cannot stress that enough. That has got to be an integral part of your daily lives at this time for us to get through this together. Another quality of life question goes to why close the walking and bike trails? I have enjoyed them for years, and there are no large groups of people. It is our only escape for mental and physical health. You know, it goes back to that social distancing. We cannot send one message to the public that please only go out for necessities and allow our parks and our trails to remain open. So we have officially closed our golf course, our tennis center, our amenities that our residents do value and have come to really embrace in our city. They will open again when we get through this. But the fact of the matter is we have 125 miles of connected trails. We have a lot, tremendous amount of parkland, park equipment that could create contamination, and it's almost enabling that behavior in this moment. And so we are walking the walk, so to speak. We are ensuring that our residents stay safe. And again, I think the more you do now, the more it'll pay off. Matt, do you want to respond any additionally? I mean, I know you had spoken to Bob about this when we were going through this decision.
Yeah, we did coordinate, and again, to your point, keeping our message consistent, following our own advice, encouraging people to stay home, to not go outdoors, to not, you know, congregate in those public places traditionally. Again, as we talked earlier about, you know, this is going to be a marathon, not a sprint, as we work together to get through this, and the essential nature of preserving the resources we have and deploying them smartly. We've been managing this crisis through data. We've been managing this crisis through the best information we have and continue to have available to us. And so we prioritize some of those resources that would have done some of those traditional park maintenance or public bathroom maintenance functions to do more important jobs of communicating and keeping our residents safe, cleaning and sanitizing facilities, and supporting the essential work here at the city. So it was both a messaging and a reality decision of stay home, stay safe, as well as us taking control of the resources we have to best deploy them to serve and keep our community as safe and healthy as possible.
And Bob, did you have anything to add to that?
Yeah, you know, this is all about our mental health too, and I think one of the keys to dealing with the stress and the isolation of being at home is, well, do something different. Like, for example, in my neighborhood, there's a lot of bike riders, and instead of biking on the beautiful trails that we have and pathways, people are practicing social distancing, and they're just riding around the neighborhood and staying apart from each other and saying hey and hello and, you know, greeting each other in that way. And so it's a new routine. Or even if you're used to bike riding, well, maybe think about going for a long walk and getting in some steps in that way. So think about developing new routines, because we're going to be dealing with this for a little while longer.
Yeah, I actually have a group of friends that live in a cul-de-sac, and they got together through email, and they separated themselves through their lawn chairs, and they sat at the end of the cul-de-sac with some drinks and just caught up, and they were all stayed very, very much apart. So finding that creativity, I think, during this time period and that connection is equally as important.
And to that point, I'm really proud of our Parks and Rec department there's a couple virtual contests happening right now, virtual art contest, a virtual film contest, all with the idea of keeping ourselves connected even though we're distanced. And the live streaming art and recreation programs that are coming for all age groups. Again, with that idea, we've done some drone flights lately that we'd like to broadcast. We want to keep people connected to their beautiful city, since we can't go to the beach right now or spend a lot of time in places that we treasure. Want to still give people that sense of connection and do that in a responsible way.
We're going to stick with a couple of the themes of the quality of life questions. I know we've combined some of the questions that were sort of repetitive. And so one of our residents that was participating in the Mayor's 90/90 Challenge was asking if it's still going on. We have suspended the challenge for the time being again. We need to make sure we're focusing on keeping our residents safe. However, you can still track those miles by hand, and when we get it up and going again, it will be extended, and you will be notified as a registrant of the 90/90 Challenge when you can start going on Palm Coast Connect and logging them again. And so our Parks and Rec team are absolutely very busy creating these virtual programs, making sure areas are kept clean and everything else. So, and responding to questions as well. And then the decision to reopen, when we would reopen the Palm Harbor Golf Club. Did you want to respond to that?
So absolutely. So we'll reopen the Palm Harbor Golf Club when we think it's safe and appropriate to do so. We're using this downtime again as we do. There was a lot of backlog of some maintenance projects that are difficult to do, time of season and peak use, and again, we chose to close that out of an abundance of caution to follow our own Stay Home, Stay Safe proclamation, to follow the governor's executive orders. We thought that was the best decision. The golf course is going to be in amazing shape when we do come out of this. Again, we're still taking care of our important assets and doing the business of the city. I want people to keep in mind that once we get through this window, as we know we will, and there will be a time when this passes, we will reassess operations. We will make sure that everything is sanitized, cleaned, and opened and ready as appropriate guidance is received from our health officer and our health department and CDC guidelines. So there'll be a phase of coming out, of recognizing it's time, of preparing our facilities once again, of ramping up operations and making sure things are in tip-top shape after sitting for a period of time. And we know people are excited to get back to the golf course and back to the amenities there, and to sit on the porch at the Green Lion again and hit a bucket of balls. And we know that's important, and we're going to do everything we can once we're through this event to get open and back to the rest of our business and treasured way of life as quickly as we can.
It's so important, again, with the CDC guidelines, again, minimizing contact, but also not congregating in a group of, more than 10, frankly. That is equally as important. So it's almost limiting also the encouragement of those rulings that they have specifically asked for and required. So we are in compliance with those CDC guidelines. This question applies to you, Bob. I think you can answer most of it. There's other things about enforcement that I would turn to Matt at this point. The governor's executive order 2082 requires a 14-day self-quarantine for individuals arriving from the tri-state area. Please explain in full detail how self-quarantine is defined, what activities are permitted and what are not, how many positive, tested, hospitalized patients are, I can take these one at a time, I know it's a lot, are currently being treated at Advent Health Palm Coast, and how prepared is the hospital for an increase in patients. So I think if you can take sort of how is self-quarantine defined, and then what activities and what are not.
Yes, so self-quarantine, that requires someone from Louisiana or from the New York tri-state area, whether they come in by airport or now through car at I-10 and I-95, they are required to quarantine, self-isolate for 14 days. That is what the executive order says. And to be honest, it truly is an honor system that we are asking for compliance for the goodwill and health and safety of the rest of us during this unprecedented time. We are getting some phone calls about individuals who are not complying, And so we're in coordination with law enforcement to just exchange and communicate that to one another in case we do have to call upon someone. So please, don't put yourself in that position. Do the right thing. You know, you're hard hit in that tri-state area. Come to Florida, and of course, we love seeing you here, but just do the right thing and self-isolate for 14 days.
And do you have an update on currently how many positive residents that have been hospitalized and are treated currently at our Advent Health Palm Coast?
To my knowledge, at Advent Health Palm Coast, one patient who was a patient a couple of weeks ago, and right now, of our 17 Flagler County residents, with one being a non-Flagler County resident who tested positive, that individual is in another hospital, but not in our county.
And Matt, I know we've been coordinating a lot with Advent Health. We have offered them the use and space of our community center, since our community center is shut down during this period of time. And so they've been communicating as far as capacity and where they are. Do you just want to mention that?
Sure. You know, again, the event planning has been going on with stakeholders since the beginning of early February, and watching some of the national and regional trends, and preparing for the worst but hoping for the best. And again, if we continue to follow these recommendations and social distance, we can achieve a better outcome. We believe that. We think we know that. But all the same, we've been working with Advent Health. A great example is trying to help coordinate and have those discussions regionally, nationally on PPE, and that's not so much our role, but doing what we can to advocate. Additionally, Advent has asked if there's an opportunity to use some public spaces that are closed, one of them being the community center, for patient screening or patient overflow, or maybe even an extension of a treatment center. So absolutely, we've offered that resource. That's I think the duty of our community to all come together and all share our resources for the best outcome we can get for our community. So we are in the midst of preparing for that, again, hoping it never happens, but making sure that we will be ready, as ready as we can be, should we have an influx of patients needing screening, treatment, or care. Additionally, we've worked with EOC, we've worked with you, Mr. Schneider, we've worked with other stakeholders and looking at those pod setups for testing. And so again, these plans are in place with Advent as our stakeholder, with our health officials, to make sure we're deploying our resources as a community, again, to the best good of our community.
And Mayor, if I may, as it relates to the hospital, Wally DeCino, who's the COO, Chief Operating Officer at the facility, he shared with us on a morning update that we do on WNZF just yesterday that people are asking about the tent that they see in back of the hospital. Well, that is part of their preparation from their incident command center, where if there is a surge of patients to their emergency room, they would be able to take care of the non-urgent, non-emergent individuals in the tent area. So they're just getting prepared and have resources and staff and supplies all set to kick that off and to start using that tent in the back of the hospital.
I would mention they've been very proactive messaging, especially with the city. At our virtual city hall, there's a tab, and we've been very current with the information and releases that Advent has pushed out. So again, it's just a great place to go to our virtual town hall at Palm Coast Connect to get up-to-date information. And I know they are committed to continuing to providing us the most accurate, timely, and useful information for us to put up at our site.
And, we want to mention, we will be having Wally on as a guest to answer all of our residents' question about what the hospital's protocols are, what their procedures are, what their plans are, how they're engaging the public. And I think that would be a great time. So residents, get prepared for your questions because Wally has been a great resource and wants to make sure the community is informed and updated as we move forward. And so, Bob, where are the testing facilities? And also elaborate on new testing kits, testing parameters.
Sure. So there are a small handful of testing sites right now in the county. Of course, the health department, we're testing throughout the day. The hospital can do testing. Our two urgent care centers, Azalea Health, I've think they've changed their name. That's our federally qualified health center on the Parkway. They're doing testing, and a small number of physicians' offices. Regarding testing kits, I think everyone knows that that has been well publicized and acknowledged. We do have still a shortage of supplies, testing reagents, sample collection kits. But, you know, our federal and state governments and just the power of our private industry, everyone is in sync to address this dilemma. And so supplies are trickling in to Florida, but going first primarily the larger supply loads to the counties in South Florida, where 40 to 45% of our cases lie. But just yesterday, the health department, we received a shipment of 100 collection kits. So that bodes well for the future, and eventually this will be addressed.
So that in extenuation of the testing, another question came in on even those who do not have the main big three symptoms. How do you view those?
Yeah, those still stay the same because of we have to prioritize because of the lack of testing supplies that we just talked about. So the prioritization are, you know, individuals with the clinical symptoms, fever, cough, shortness of breath. So clinical symptoms first. You know, if you've traveled or been on a cruise, but most importantly, patients who have been hospitalized, healthcare workers, residents in our nursing homes and long-term care facilities. They are the most vulnerable in our community, so we're very concerned about them. Clinical symptoms in people who are over the age of 65 and have underlying conditions like diabetes, congestive heart failure, COPD, lung disease, heart disease, and anyone who is immunosuppressed, for example, a cancer patient, and especially anyone who has been exposed, has the clinical symptoms, and has been in close contact, like I explained earlier, with a positive infected person or someone who is a presumptive positive infected person. Those are our priorities for testing criteria right now. Taken all together, this is called diagnostic testing. You know, we mentioned what Abbott Labs is doing and producing these rapid testing kits. Well, how wonderful that would be if we can get to the point where testing then would be widespread. You know, just like the flu test that you get in your doctor's office, it takes 15 minutes to get the test result. That's where we're headed. So that's when we can do widespread, broad surveillance testing. But that's a ways away yet. So we're still doing the diagnostic testing with these testing criteria that have to be applied.
So again, additional questions about, I think we've covered a lot of the testing questions, but really, can you speak in more detail about the contact tracing? What occurs? Who does that? Who is responsible for that? How people are notified if there was indeed a contact made?
So again, we're looking for close contact, which is a prolonged exposure within 6 feet of a positive infected case. The health department, we are responsible for doing the contact tracing. That would be our public health nurses and our disease investigators. And we're pretty used to doing this. We actually do this, Mayor and Matt, on a weekly basis. People have sexually transmitted disease, so that doesn't spread in our community. We do ask that patient, okay, tell us, who have you been with intimately, so that we can then contact that person to avoid spread in our community. Same analogy here, same thing. Who have you been in close contact with? And so we ask those questions, and then we start on the phone, we start contacting all those individuals that are within that close contact, high-risk category. And then we talk to them and ask questions like, so who have you been in close contact with? Who have possibly you exposed? And we just keep that going. So it is very manpower intensive. It takes a lot of time, but during this situation, it is extremely critical. So we make contact with those individuals who might be at risk. We provide guidance, and if they have the clinical symptoms, we ask them to contact us immediately, and we tell them, if you got those 3 symptoms in particular, the fever, the coughing, the shortness of breath, please isolate at home for 14 days, get in touch with us so that we can provide further guidance and support.
Right. Thank you so much. Okay, the question now is, when are you going to completely shut everything down? We obviously are working in consultation with many of our stakeholders and partners, and understanding that as this has spread throughout the country, we are closely monitoring how it's impacting our community. And so I can tell you that even as of this morning, we have had conversations in regards to if that does need to occur, when that would occur, how we would go about doing it. We are taking this, I can't emphasize this enough, unbelievably serious. It doesn't help when you do see groups out there congregating together. It doesn't help. I was speaking with the sheriff the other day, and the Florida Fish and Wildlife had ordered boaters to have less than 10 people in their boat at any given time, and don't congregate. Don't shore up on the beach and tie up all your boats together. That is dangerous. That is actually not socially distancing. It's creating a health crisis even more than what we have. Yeah. And so that enforcement component, that puts a strain on our law enforcement, frankly, that their officers and their agency is still responding to the everyday calls they're getting. So think about that. The more you can do to ensure that you are staying inside, you are not going inside, we can get through this as quickly as humanly possible. But the fact of the matter is, we have had residents congregate. We have had residents go out in boats, more than 10. And we know this is happening. And we know we've had people on our beaches and everything else. So that determination will be made in the best interest of our community, the safety of our community. And when we're getting indications that this is spreading, that we know the only way to do that is to mitigate the spread of that by to keep everyone isolated and out of the range of each other. You will be the first to know as a resident, because we will actually put out that order. So I would say stay tuned for that. We are having conversations throughout the day, probably every hour at this point. And the stakeholders that have been involved are very helpful in this process, because as Matt indicated, a lot of this is driven on data, science, that we know, our role is to ensure your safety. So is the health department, so are first responders, so are our healthcare workers, and we're trying to keep them healthy and safe as well. So the more you stay home, the better it will be. And so you definitely will get that message very clearly when and if we adopt that order. So we will go now to, again, we have 4 questions about the mandated stay-at-home order. Did you want to add anything to that, Matt?
To a mandated stay-at-home
Yes.
order? Again, I think we're managing, to your point, the expectation and the reality of this, minute by minute, day by day, and we'll do what is necessary to act in the best interest of this community. And I think the leadership commitment is absolutely there, and our stakeholder commitment is there to make sure that we are taking those steps.
Yeah. So this one's a really good question. It's an interesting timing. Is moving to or from a home in Palm Coast to either inside or outside the county considered essential travel under the current stay-at-home? So I would probably say moving if you're going to have contact with movers, correct? What would you say, Bob?
Yeah, practice social distancing. Those movers will probably be wearing gloves and kind of look at each other from afar and say, that is what our recommendation would be, absolutely. And, you know, about traveling back and forth ourselves from county to county, you know, if it's absolutely emergent and if it has to take place, of course. But if something can be delayed, postponed till later, really think about doing it. Please consider that, because that's just, you know, one little tool in our toolkit under that social distancing umbrella that is really important.
I agree.
I would echo that, and you know, one of the challenges we're learning is about resource management as much as anything else, and it's managing the tools, the manpower, and the physical resources we have. I would echo, you know, agree with you 100%, Bob, and also note that if you're moving from one of those community spread areas, the order is to self-isolate for 14 days and help us, you know, stop or prevent that community spread from reaching Flagler County.
That's right.
And this goes back to the question about the hospital. What is the plan for medical facilities in our hospital, if our hospital is overrun? We know in partnership with Advent Health, in constant communication with them, they have a plan in place. We are working that plan with them. And you will hear more about that next week with Advent coming online. This next question has been presented actually from the media. And so Palm Coast residents are concerned about New Yorkers coming down that are not self-quarantined. Are there any protocols to monitor the situation? How is the situation being policed? Who is involved in the decision-making process and how to deal with COVID-19? Are you happy with the way the Department of Health is handling everything regarding COVID-19? Specifically in how the department is communicating. I will speak to, and Matt as well, to the handling of the COVID-19 from the health department. There has not been a day that has not gone by that we have not had constant communication with our health department, which is encouraging because, as you know, it's about communication and education to get through this. And they're on the morning calls, they're on the morning radio, they're on here weekly, and I've been on their radio show as well. And so you have seen some very strong collaborative stakeholder engagement, involvement. I have been pleased. In the beginning, I had to understand that you are working under the confines of the state health department.
Yes.
You are not an independent health department.
No.
So I think you're one of 55 in the state of Florida?
One of 67 health departments.
Okay.
Yes, we are, Mayor, and we're one integrated health department. For the person who asked that question, I just want to point out a couple of things that are very important. First of all, please check out the www.floridahealth.gov site. This is where the dashboard is that's updated twice a day with a plethora of information and data by county, by city, number of lab tests that have been done statewide, so much information about who's hospitalized, how many individuals, how many deaths, and it's updated. And that is our knowledge base. I mean, I might know the data 10 minutes before the public knows it. And again, updated twice a day. And the information there is verified. It is the truth. There's no holding back of information. Quite frankly, that would be outrageous. Quite frankly, that would be against the law in the state of Florida. It is what it is. So I'm telling you, please check out the website. What we share with the community is what we have from the State Department of Health in Tallahassee, where all this information is gathered and sent out to the public. The other point I wanted to make is that it is also state law and statutes that when we do epidemiological investigations like this, the contact tracing, the monitoring, the messaging about cases statewide and here locally, we have to abide by, you've heard the term HIPAA, we have to abide by privacy and confidentiality laws. So, you know, people have yearned for real detailed information about persons under investigation and our epidemiological tasks. And by law, we cannot share that. So we're kind of stuck sometimes, at least early on in this crisis, we're stuck between this, this desire and this want to share individual information that we can't, and yet be good stewards of the community and to balance the public's right to know and good knowledge and information versus protecting always the privacy and confidentiality of our patients. We're healthcare providers, just like hospitals, nursing homes, long-term care facilities. It would be against the law for us to break that trust, confidentiality, and privacy of all of our patients. That is sacrosanct as healthcare providers, and we will continue to adhere to that rule and to the law regarding it.
And just to add, who is policing the situation? That falls under the purview, obviously, of our Sheriff's Department for enforcement of all state executive orders, county executive orders, local municipality executive orders, and so our sheriff is constantly communicating that and trying to educate our residents, frankly, about the self-quarantine. If you are coming in from New York, the governor's asked for you to please make sure you take that seriously and don't create, further spreading within our community. So if you are aware, I've received some phone calls about it. We have alerted the appropriate authorities immediately to ensure the safety of our residents.
Mayor, if I may,
Yes.
just one more point there. Just being honest, and this probably holds for most health departments, we have our hands full right now, and we're doing well on following up and treating those who have tested positive, doing testing throughout the day, the contact tracing, monitoring all those persons under investigation, which now number 200. We have put a call out for retired nurses and volunteers who can help us with manning the phones remotely at their home. And thank goodness we got an immediate response from 20 people, retired nurses, retired healthcare workers, and others who are very capable and willing to help us with, the more routine task of, hey, how are you doing? Are you self-isolating at home? What is your temperature? How is your family doing? And then that information then goes to us at the Department of Health. So we're very fortunate to have these volunteers to help us. This is a huge task, and we do not have the staff to go to hotels, to go to households, knock on doors to determine whether or not someone from New York or Louisiana is staying put. That is the responsibility, personal responsibility as good citizens of these individuals and Americans to follow the executive order by the governor to stay home. If we get an inordinate amount of complaints about like a particular person, we want to know about it, and when we know about it, we're going to contact the sheriff. I spoke to him about this just yesterday, and these individuals will be paid a visit.
Absolutely, and I know he's taking that very seriously as well. All right, so we're going to move to a different set of questions. I'm going to put this to Matt Morton. I heard the city has toilet paper if people run out. Is this true? And if so, how long do I go? How do I go about getting some? Sorry.
No, it's a great question. We all chuckle. We're all in the same boat, and we're all running out of toilet paper. So, first, what we're hearing, we've been in contact with supply chain. We've been in contact with our local stores and our vendors. There is not a production problem with toilet paper in the United States. So, again, I'm going to echo what we've heard. Please be responsible when you purchase toilet paper. Think of other people. There is no need to hoard toilet paper or to over-purchase toilet paper. I want to go back because, to me it's really interesting. It brings up 2 points about the toilet paper. Why I keep asking people go, why are you asking us to create a Palm Coast Connect account and log a case? We learned about the dire situation. We get a lot of anecdotal evidence, a lot of media reports, shortage, but to hear the stories we heard and the cases created elevated that issue for us for a response. It prioritized it over some other things. We recognize that in this era of social distancing and a lot of the events that we had closed, events that were going to be canceled or postponed for another year, that in some of those event budgets, we would usually pay for advertising or pay for, the sunglasses you get from the city or, event materials. And we said, why don't we prioritize that money that would have been used for other things and help our community? That's our duty, to help our community to the best extent possible. Early on, we were able to secure, I know the exact count because we discussed it time and time again, 496 rolls of toilet paper. We delivered those to a residence, so we were able to affect about 250, homes in our community, or dwelling units in our community. We have a standing order with our industrial suppliers, so that is outside of the traditional Publix or, Walgreens supply chain, so we're not in direct competition and taking toilet paper away from our residents. We're getting it from commercial suppliers. We will continue to try to procure. We're expecting another order to come in. So if you have a case that's logged in, if you have a case in Palm Coast Connect, we're going to revisit those. We'll announce again when we have some more the opportunity to distribute that. And I'm going to talk on the backside of the toilet paper issue. Here again, we saw people logging cases through Palm Coast Connect about an extraordinary number of sewer and pep tank issues. Again, elevates our radar. Why are we getting so many calls? It's a drought. It's not like a hurricane where we're expecting overflows or other failures. Failure is uncharacteristic. What did we learn by paying attention to you logging those cases? Is that people were flushing wipes and paper towels and other things that will not get through a pep pump into the sewer. So again, help us with the data, help us lead and learn and do a better job being responsive. We can do a better job as a community. If you go create that case, take a few minutes to help us understand what is happening on the streets. And so yes, to get back to the answer everyone wants to know, we're doing our best. We're going to try to get some more toilet paper, and when we do, we'll do our best to distribute it again.
And help your neighbors. I mean, again, if there's a message there and you can share a roll, please do that. We're all in this together. We're trying to get through this together. And I see we're down to literally 5 minutes remaining for our hour, and we have not gotten through the questions, unfortunately. A lot of important information, though, has been discussed today that I'm grateful that our residents can really, truly understand the difficult dynamic and the challenges we are faced with. So we will be posting the rest of these questions and answers on our webpage, on our Facebook, on our Palm Coast Connect. Go there, register, log your cases. It helps make better decisions. We have a business assistance center on there. So there's questions about, how we're helping our businesses. I know that you will be working closely with Congressman Waltz about the stimulus package and how that's, actually impacting our local communities, what benefit, how we can be helpful in that. We have our Advent Health under public safety tile for updates there. We have our health department for updates there. We have Just City related business for updates there. This is the source of information that we've all compiled together to help our residents stay informed, stay up to date, and stay safe. I know that I want to leave just a couple minutes for some closing statements from the co-host today. And, Bob, I will turn it over to you first.
Yeah, it's just so unprecedented what's happening here. I mean, as a public health officer, my team and I, we were discussing this today and have discussed it with colleagues. I mean, yes, we certainly had a sense that this might happen. But, a pandemic that has involved 150 countries around the world, we are not alone. And it just, we love Flagler County. I know the individuals here love our county. We love the city of Palm Coast and all the cities. And if we can just embrace each other and just, get through this together, support each other, maybe at times give each other a break, this will pass, but it is going to be a rough road. Just being honest, over the next 4 to 6 weeks, that curve is we want to round that curve, but that it's going like this, and we're right about here. So we have a ways to go, and we'll get out of this quicker if we embrace all the things that we've been talking about regarding distancing, quarantining ourselves, and the mayor's put it perfectly. Just stay away from each other and just adopt new routines of communication.
Thank you so much, and please make sure you're registering for next week as well, because we're keeping this going. We want more and more participation, so please feel free to share with your neighbors, share in your email lists. Make sure, again, you're sharing with your organizations that we are really encouraging to practice that distancing. You will hear us say this over and over and over again. We cannot express it strongly enough. And then I will turn to you, Matt, to close us out.
Thank you. So, this has been unprecedented. There hasn't been a rule book. There was no manual or playbook, to deal with a global pandemic. Suffice to say, this is not a 9-to-5 crisis. We're not Monday through Friday. No one has been treating it like a 9-to-5 Monday through Friday crisis. I'm very impressed and grateful for the coordination. Bob, I know I've called you in the evenings and weekends, all hours of the night. I had a phone call the other night at almost 1 o'clock in the morning. All of our partners are taking this very seriously. The mayor and council, again, the leadership shown and the response and the proactive stance here. Again, be patient, work with your neighbors. We are neighbors. We live in a phenomenal place for a reason. We know this has been externally disruptive to lives, to recreations, to routines. The quicker and the better we adhere to the advice, the stay at home, stay safe order, the recommendations of the CDC, the recommendations of our health department, the sooner we'll get through this. And to your point, to flatten that curve is essential right now. So we're just asking for your help as our community to comply with these orders and to help us, again, by giving us information to aid in our response.
Okay, Palm Coast, that concludes our first virtual town hall. Thank you so much for all the residents' participation. Thank you for your questions, by the way. This has helped us guide the narrative and the story that we need to tell. So your questions are equally as important. Keep them coming. And again, make sure you're signing up every single week, and logging into Palm Coast Connect will help you stay informed and stay safe. Thank you.